Great.
Okay.
Yes, thank you, Ingrid. I really appreciate it. Hi, everybody. Good morning, good afternoon. Calling or from a conference in Los Angeles, so hopefully everyone can hear me well. Really excited to have you all here today for this learning opportunity. We had a great session a couple of days ago, and this is our second one. So really excited that you could all join us. And I do recognize folks already on the screen, but if you don't know me, my name is Brian Malty. I'm the executive director of the Hope and Heal Fund. And again, I'm excited for this for many reasons. One is this was literally the first grant we ever made back in 2016 to Berkeley Media Studies Group on narrative change work. And as you can see, it's been quite a process. And I know Pam will take us through some of the stuff that we've done over the years, but it's a long time in the making. But what was really important to me and to us at Hope and Heal Fund as one of the first projects is to really change the narrative on gun violence prevention, right? We know that they're often overlooked forms of gun violence like intimate partner violence, firearm suicide, things like that. And we know that there are certain narratives out there on this issue that needed to be changed. So we're so thrilled this is all coming to fruition for something that started back in 2017. So again, this is one of our first priorities, and I also wanted to elaborate a little bit on why narrative change, in addition to the fact that we do know that narratives need to be changed. We also see, and again, Pam will talk a lot about this in a moment, but a lot of harmful frames that have come from the media and from others about the work and the people who live in certain areas. We feel strongly about credible messengers. We feel like the folks from the community need to be telling their own stories about their own communities. And just as importantly, and we'll hear from Kelvin a little bit later on, and others, that a lot of times there's good work going on in these in communities, but community members are not getting the credit, right? And the credit may be going to law enforcement. There may be people who don't even understand what solutions are happening in their own community. So for us, it's really just more than a narrative change. It's really empowering communities to tell their own stories and their own narratives about their own communities. And again, super important to be lifting up those solutions. And these are things that could really drive change, and they can drive funding to communities, right? There's so many benefits that can come from this. So we're really excited. Before we move on I also wanted to call out or shout out to Dr. Jessica Beard, from Director of Research at the Philadelphia Center for Gun Violence Reporting. There are very few folks really nationally that are focused on narrative change in this sort of way, but the Philadelphia Center for Gun Violence Reporting is definitely one of them. So definitely want to give a big shout out to them. And again, this kind of storytelling work is helping pave the way for culturally responsive and healing approaches to firearm violence prevention. We're so proud to be a part of that. And with that, I will hand it over to the amazing team at Berkeley Media Studies Group to take us through today's workshop. So thank you very much for all being here.
Great. Thank you so much, Brian. We will move into our training quickly. Again, like Brian said, we are here to talk about framing and messaging around the prevention of violence associated with firearms. So hopefully you're in the right place. I'll share a little bit about myself and then hand it over to my colleague, Pamela Mejia, the director of the research team, to talk about her work and her experience. I am head of strategic consultation at BMSG. I've been with the organization for about 15 years now, and really enjoy the work on the ground with folks who are trying to move their messaging along. So we on the training team work with advocates across the country to understand how are people using this messaging, what kind of information do people need about how the media functions. We work across issue areas, and so one of the things that we like to say is that we're not experts in any one particular issue area. We're really advise people and build capacity on the use of media advocacy to advance social change. But you all are the experts on your specific issue areas and the content. That being said, I want to pass it over to Pamela, who has been working very, very deep for very many years on the prevention of violence. And so she has a special sort of qualification that she's not only an expert in the media advocacy side of things, but also in the content area of violence prevention. So let me pass it off to Pam to share a little bit more about herself.
Hi, everybody. Pamela Mejia, use she, her, Aya pronouns, Director of Research, Associate Program Director. Very excited to be here and see some of my friends on the call. Hey, Mary Lou, some other folks I know, and or have names I have seen on email chains. So nice to have to be in a space with y'all. I've been working with Brian and the Hope and Heal team on this project since 2017. I prefer not to think about how long ago that is now. And really excited to be here today with you all to talk a little bit about what we've learned and also do some sharing and co-thinking together, because I would say the biggest takeaway from this project is that and part of the reason that it is been such a long process is because the work is always changing as the world around us and as firearm injury and violence in the world around us keeps changing and sometimes evolving in the way that it's being framed and discussed in the media. So really, really looking forward to digging into some of the problems that we've seen, many of which I'm sure people on this call are familiar with, but also think some of the ways that we found that it's possible to structure messages and communication strategies to meet some of those challenges and illustrate for folks, for example, that prevention is possible, that we all have a stake and a role in it, that uh, um, it's not all about increasing incarceration or the number of police in our communities, and that in fact police aren't the only people with a stake and a role in creating and maintaining the communities we want to be in and see and raise our families and be and live with our loved ones in. So as we say, there's going to be a lot of different pieces that we're going to share today. And I do want to also preview that we're going to be giving a little bit of insight into an interactive resource guide that is going to be made available in early October. You all receive that link as participants in this training, but we are going to preview it today and show how it can be used to put into practice some of the recommendations that we're making to construct your own, again, communication strategies, messages, etc. In addition to using the slides and other resources that we'll share today. So with that, I'm going to hand it back to Ingrid to get us going.
Thanks, Pam. I'll just share a little bit about who we are at BMSG in case there are folks on the call we haven't met or worked with before. If I can advance the slides, that is. So we do a few different things. Pamela and I have sort of touched on the primary ones. So we look in our research practices, look at how issues are being framed in the news, either at a particular moment in time or retrospectively, to understand how are issues being framed that are working in support of our systems change goals? What do we need to be continuing that's helping advance our agenda? And what do we need to be shifting on? Where can we learn from how the media is framing a particular issue in order to shift toward a more equitable society like Pam was talking about. We also do trainings like this one for advocates across the country. Sometimes it'll be smaller groups like this one. We also work at the national level. We might be at an entire conference training, multiple departments at one time. And again, either working on big picture media advocacy concepts in theory, all the way down to very specific campaign consultation. So do a lot of different capacity building type activities. And then finally, we also work with journalists. So journalists are the ones who really have the ear at the national level in our mainstream media. And so we want to make sure they're telling the stories the way that that we're experiencing them on the ground. We want to make sure that they're really framing things from that social justice perspective and framing it from a systems perspective versus like that individual behavior change, which is the way journalists essentially are taught in schools, no fault of their own. That's what people are interested in, but we'd really love to see our journalists covering issues really from that historical systems change perspective that advances the public health work that we're trying to achieve. So a few things that we're hoping to get through today in our time together. And I think because it's a smaller group, we'll be able to have a lot of interaction. So we really do encourage as much raising your hand, asking questions, getting involved. We want to understand, like Pam said, what can we learn from the analysis of the framing of violence with firearms in the news? How can we pair problem and solution statements? So making sure that as much as upset as we may be about the particular issues that we're seeing in our community, what are the solutions that we're putting forward? And how can we make sure that those solutions are front and center in our messaging? We'll talk about a case study or experience that Kelvin Ward is going to share with us about his work at ICUC. So we're really excited to have him here with us today. And then finally, we're going to work on some message development skills. So we're going to actually put pen to paper, so to speak, work on our message development on the page, as well as if we have time, and I think we will, actual delivery of messages and giving and getting feedback from each other. So with that said, I'll pass it back to Pam to talk about the research that we've been referring to.
Of course. Well, I am a big research nerd, as the people on this call who know me will know. I could talk about this forever. I will not do that, but I will preview that everything I'm going to talk about today is included in a lot more depth. There's a lot more resources to return back to in that message guide that I mentioned is going live next week. But to give a very brief overview, we wanted to understand, how it is that the news is talking about firearm injury and death, especially the kinds of firearm and injury and death that we know are happening every day. For example, community violence, community levels assaults and murders that involve firearms, which actually don't account for the majority of injuries and deaths, but you wouldn't know that from news coverage, as we'll find out. As well as things like domestic violence involving firearms and firearm suicide, which is a huge and a leading driver of injury and fatality from firearms in this country. But is it understood as such? And how, if at all, is the kind of the news, which gives us such an important piece of the public conversation about an issue, talking about these very, very complex kinds of violence and harm that happen every single day? So to understand that, we did an analysis first in 2016 and 2017, and then again in 2020 and 2021 to identify patterns in California news about injury and death from firearms. And those resources are going to be shared in the chat, and they're also discussed, as I said, in more depth in the resource guide. When we found some kind of key patterns, some strengths, some limitations of the coverage, which I'll talk more about in a moment. But we also wanted to understand how that aligns with the work and experiences of people who are in the field every day, who are doing prevention work, who are doing intervention, violence interruption, who are doing healing work, who are building and maintaining and experiencing the communities that we around California that we live in and that are undergoing and sometimes experiencing harm. And are also experiencing strength and growth and liberation and healing. So we spoke pretty extensively and did a lot of interviews, meetings, and listening sessions with community members, field leaders, some of whom have been on this call or who are on this call, or are friends or partners with people on this call. We spoke with Russell Lemley in the firearm suicide space really extensively, for example, and I heard him mentioned early on in the conversation. To really understand where, what those field leaders and thought leaders' perspectives were on media and on what they would want to see more or less of in an ideal world when it comes to what the media would say about preventing and addressing injury and death from firearms. And just a quick note, you'll notice I try to say as much as possible injury and death from firearms or firearm injury and death. I really try to not use the term firearm violence if I can. Not always possible, but if I can, because we know that gun violence and firearm violence is a very politically fraught, shall we say, term. One that can really make a lot of people feel very shut out of the conversation because they have a very specific understanding of what gun violence means or what gun violence prevention means. So as much as possible, I try to be really specific and say that we're talking about reducing injury and death from guns or injury and death from firearms, because that's something that regardless of political ideation or ideology, people can really get behind. Anyway, just a little communications tidbit from me to you. Based on the news analysis and all the listening and conversations we had with experts in the field and community members, we did some polling and message testing with Lake Research Partners to identify how Californians are thinking about community-led solutions to firearm suicide, to community violence involving firearms, and domestic violence involving firearms. And we finally brought all of that together into the message guide I mentioned, as well as trainings and conversations and workshops like this one, which again, these are the first of these trainings and workshops, but we're hoping to have many more in the weeks and months ahead. I'll just say a little bit about what we learned because I'd love to get more into hearing about how these findings resonate with you all and what what, you know, how they align with what you all have experienced and know of media and public opinion about firearms. So Ingrid, if you could move to the next slide. Or maybe I can move to, oh, okay. A few quick highlights across issue areas, whether domestic violence, firearms, suicide, or community violence. Media attention to all forms of injury and death from firearms is on the increase. This is an area that there's a lot of attention to, even more so in 2020 and 2021 than there was in 2016. And I'm sure anecdotally that that trend probably continues now. This is an issue we all care a lot about, and reporters and journalists know that. News about community violence involving firearms, as I kind of hinted earlier, is very common. There are tons and tons of stories every single day all around California about street level assaults and injuries and attacks and homicides. But by contrast, even though domestic violence involving firearms and firearm suicide are very, very common occurrences, there's very, very little news coverage about it. So, a question we often ask at BMSG is, if people only knew about your issue from the news, what would they know? What wouldn't they know? Well, they might not know that firearm suicide and domestic violence involving firearms are significant problems that folks around the state are working to address. A third finding was that across issues, when we did see some conversation about solutions, but it was almost always solutions that were very deeply rooted in policing. So more policing, longer jail sentences, etc. And most of the speakers quoted were also members of the criminal justice system. And those folks have an important perspective to share, but not the only perspective. And the problem is that we didn't really see a lot of other speakers from, for example, community organizations or faith-based organizations or any of the other folks who are involved in our communities. And we also didn't really see any conversation about the different kinds of community-led solutions that we also know can help prevent and reduce violence and support healing for those who've experienced it. So that's a lot of things that are not maybe great about the media narrative, but there is some good news. Oh, excuse me, that is not the good news. Sorry, I was going to go to the next slide. There was some good news there. This is not good news. Across another kind of issue point that we found in terms of the media coverage is that news really pretty regularly repeated some pretty harmful misconceptions about different issue areas, whether it was language in domestic violence stories that blamed victims implicitly or explicitly, to language in stories about community violence that perpetuated harmful and racist stereotypes, to language about suicide that broke best practices in reporting on firearm suicide. So again, across issue areas, we did see some pretty problematic patterns in coverage that show a lot of opportunities to correct misinformation or fill in the gaps that maybe aren't getting talked about. Now let's get to the next slide. Well, again, I got to lead with a little bit of information that's maybe a little disheartening thinking about things. And oh, I see a comment in the chat. I just want to make sure I'm not missing anything. A great question, Mary Lou. I always expect a good question from you. I think that I think that your question is, how much of the coverage is driven by police news releases? I don't have that number off the top of my head, but I will say that the overwhelming majority of stories about any kind of firearm injury or violence, particularly community violence, is driven by the release of a piece of information from a police department about the details of a crime. So I don't have the specific number, but your instinct, if I'm reading it right, is quite correct. That in fact, the news hook, as we often call it, the reason a story appears on a given day, is driven by news reported from a police department about the details of a crime. Okay. Well, to return to a little bit of our research findings. So we looked at news. As you remember from that previous slide, we talked to folks, and then we also did some public opinion polling. And what we learned from the public opinion polling was, again, some not great news, but I promise this time I am leading to some actual good news. But to start with, from some things that we would love to see some places we would love to see changes happening, We found that when people heard the terms like terms about community violence, they tended to overwhelmingly default to thinking about gang violence, which is an incredibly um, a term with a a deep history of racist and classist connotations, that has a lot of very specific policy mechanisms associated with it. And that is, again, where people's minds tend to go when they hear the phrase community violence. Another finding that we made that was really startling to us, particularly to me as somebody who's been working in the domestic violence field for over 14 years, is that many Californians are not aware that domestic violence involving firearms is actually a really significant problem. In fact, only 40% of Californians polled actually understood that domestic violence involving firearms is a significant problem in the state and one that drives a lot of injury and death. When people hear or talk about firearm suicide, they think it's a serious problem. And they tend to think primarily about mental health problems and solutions. Those are important, of course, but what does kind of seem to be missing from people's understanding or thinking about firearm suicide is the role that firearm availability or safe storage mechanisms could play in mitigating the risk of firearm suicide. So again, when people think about firearm suicide, they know it's an issue and a concern, but they're not thinking about it in the context of also like what is the what could work to address the availability or storage of firearms do to help reduce some of that risk. Now here's the good news that I was building to this whole time is that even though we know that there are some frames and some thoughts and ideas going around that are very pervasive in how people are thinking about firearms in California, the really good news is that we did find that across issues, if you go to the last bullet, I think this is my good piece of news that I like to end on. Did I take that out? Oh no, is it not in there? Oh no. Oh, there we go. Across issue areas, people are really hungry for solutions, including those community-led solutions, the ones that go beyond criminal justice reform, right? So there's a lot of conversation and enthusiasm around some of those criminal justice solutions. I won't say there isn't, but people are also really anxious and eager to learn about things like what can happen in communities and what can happen in neighborhoods and what can happen that doesn't just depend on state or federal legislation or on more cops or more prisons. So again, this is an area where this is kind of the high point I've been building to this whole time, right? Is that there are some places where the narratives are maybe not what we would love to see, or that there are opportunities for shift and change. But the good news is that this is a place where there is hunger and appetite for change and where people are eager to learn more about what can happen in communities to prevent and address violence and how they can be a part of it. And that really means that there's a lot of really fertile ground. I like to mix my metaphors, but there you go. There's a lot of really fertile ground for some of the narrative change efforts that we're talking about today and are going to talk about more. So with that said, I'm going to stop talking and hand it back over to Ingrid.
Thanks so much, Pam. These are some not surprising findings. And one of the things that we know is probably least surprising of all to folks on the call is that there's so much happening in the world of violence prevention, both advancing our work and holding us back a little bit, that's not being covered in the news. And one of the questions that we have for you all is what Pam mentioned about what would people, if all people knew about violence prevention was what they got from the news, what would they know and what would they not know? It's a big question that we have, and that we want to facilitate a discussion with this group. I'll put the prompt in the chat and you're welcome to share your thoughts. Oops, I might put the prompt in the chat. There we go. Welcome to share your thoughts in the chat. Also, you're free to come off mute. Like I said, we'd love to facilitate a conversation with folks on the call. So if you have ideas about this, if all someone knew about violence prevention or or healing work in your community was from the news, what would they know? What would they think was true, or maybe the only truths, or what would they not know?
I'm happy to jump off mute while others may be typing. Hi, I'm Taylor with Project Unloaded. I think the thing that that like I always struggle with, and I'm curious for thoughts on since y'all have done this research, is around gun suicide, because there's so much hesitancy in reporting on it because of the fear of contagion. But that also leads people to believe that they're safe with a gun at home because they don't understand the risk that firearms pose in the home, when it comes to the lives of themselves or their loved ones. And so like I understand the tricky place that media is in there of not wanting to make the problem worse, but in doing so, they ignore it. And that is, of course, a problem too.
Great, absolutely, Taylor. Thank you. Thank you so much. Pamela, I'll just give you the open door to comment or probe a little bit further on any of these topics, since this is certainly your area of expertise.
Absolutely. Well, I would definitely say that, and this is an area where I'm not sure who on the call mentioned Russell. This is an area where Russell Lemley and myself have had a lot of really robust conversations. Russell is with the VA here in the Bay Area, and agree. I think, you know, his argument and one that some other folks that I've talked to in the process of doing this work have agreed upon is as you say, the idea that there is potentially a risk of, as you say, what used to be called copycat or contagion, but potentially the risk that's imposed by not talking about firearms and the role that, for example, safe storage could potentially play in mitigating in promoting safety, is actually creating more problems and is actually a bigger threat. And Brian, I don't want to misrepresent Russell's comments, so please do step in if I'm saying that wrong. So I don't have a takeaway for that, but I would say that I do think that there is an increasing movement led by folks in the safe storage and firearm suicide prevention, gun suicide prevention community to work with reporters around what it will take to shift some of those recommendations to, again, align with what's known in the science, but also to, you know, take a responsible public health lens around making people aware of the role that of the, excuse me, the harm of firearms, and the role that they play in suicide. And again, Brian, if there's something I've misstated here, please do let me know, because I don't want to misrepresent Russell or anybody.
Thanks, Pam. I'll just put voice to some of these messages that folks sent in the chat. Diana says, viewers from news will know a lot about school shootings, and we only think about gang violence. They would not know too much about healing practices and how CBOs are focusing on trauma care. Absolutely. Thanks for sharing that. And that's one of the things that we hope folks on the call will get out of today, is really how can we all be telling the positive stories more effectively so that decision makers and law enforcement understand what good things are happening in the community and how we actually are contributing in such powerful ways. Alexis says, if they only knew what was on the news, it would make violence feel inevitable and would not address the many efforts to address community violence. So similar, that there's so much going on the ground that folks are not aware of, because those are not the stories that we're seeing in our day-to-day news. Melissa says, I think many would think that violence, many would think that violence is on the rise everywhere when it is in fact decreasing in some places, especially those investing in, I think this is community violence prevention, maybe. I think they would think about mass shootings primarily. I think they would assume in many cases that solutions are focused on gun control and policing criminal justice. Thanks for that, Melissa. Mary Lou says, +1 to Melissa. People think violence is increasing and are afraid. Also, people attribute violence to people of color and immigrants. More police and punishment are the perceived solutions. People wouldn't know about community alternative to police and violence interrupters. Great. And then Taylor, hopefully you saw the message from Pam about reconnecting on your comment and question. So thanks to everyone for sharing those important tidbits about what's being shared in the news and what's missing in the news. We know that news is only covering a small amount of the really important work that's going on in our communities. I'm gonna actually move things around a little bit just because of the perfect segue here. I want to introduce, and you'll see me advancing past some slides. I want to introduce Kelvin Ward, who is who leads the violence intervention and prevention advocacy work at Inland Congregations United for Change. Kelvin has some really interesting and powerful stories to share about their work. And I think this is the perfect time to invite Kelvin to share some of those stories that we know are not being covered in the news, but are really having such a powerful impact on communities. So Kelvin, if you can come off mute and just talk a little bit about your work, we'd really appreciate it.
Yeah, good afternoon, everyone. Again, thank you for inviting me for this second day of this powerful and amazing information that we're receiving. So my name is, again, Kelvin Ward. I am a community organizer with Inland Congregations United for Change. I work out of our San Bernardino office. If anyone knows anything about San Bernardino, one of the narratives that has been written about San Bernardino throughout the years is that statistically, it is one of the unsafest cities to live in. It's been ridden with an extreme amount of violence, and particularly gun-related violence. About, I think it was 2015, there was a terroristic attack on a agency in the city of San Bernardino. There was about 14 people that were killed, that lost their lives, about 22 individuals that were injured. And out of that, our organization has always organized in faith-based congregations, synagogues, Catholic parishes, mosque, et cetera, et cetera. So there was some very amazing faith leaders that got together across religiously diverse areas. And we, in turn, I wasn't with the organization at the time, but established a prayer walk to establish some solidarity and unification within the city to draw attention to this senseless, violent act that had taken place. And it really morphed into a monthly call where leaders would get together in the community, go out once a month in what was then called our Common Ground for Peace prayer walks. And so we would go to different sections of the city where violence had taken place, more specifically, a murder would occur, or had occurred, I should say. And when I was brought on about 5 years ago, I was brought on to lead our violence intervention prevention work, which we were trying to establish in the city by means of gaining political will and support to establish a program that could be funded by the city so that we could move into this work more effectively. So to bring you up to speed, we did gather the support that we needed, although anemic, but it was enough for the city to hire an internal manager to oversee the program, to write some grants, and we did receive some funding from an organization called CalVIP. And that has been going on for the last probably like 4 years. So what has come out of that has been some very amazing direct service partners that we have gathered, Hope Culture, Young Visionaries, Loma Linda Medical Center, and a group called Operation New Hope. They do all the direct service work on the ground, except for Loma Linda University Medical Center, which we established a hospital-based violence intervention program there, which they do direct service work based upon patients that they see that come into the hospital that have been the victim of gunshot stabbing victims, that they are able to directly contact and see about, I should say, offer direct service, wraparound services, I should say, to those persons. The challenge is this: I gave you all the fluff and the good aspects of our work. The challenge is the narrative around the work that has been done. To give you one example, to date, since these direct service partners have been operating in our city, we have seen about a 53% reduction in gun-related homicides. There's some other statistics that we have, but that's the major one that I want to lead with. However, the challenge again has been the narrative leans more toward law enforcement only, that has been credited to this awesome reduction that we've seen over the years. In fact, I think up to date, there's been, unfortunately, 12 murders to date, but last year, that number was around 24, 25. But again, going back to this challenge, in meetings that we attend or that we hear about, the credit has gone to law enforcement. Now, I will not discredit the work that law enforcement has done, because they're doing an awesome job. San Bernardino hired a new chief of police about 2 years ago. We had 2 interim chief of police for about 2.5, 3 years. And so there was a lack of stability within the department, as well as during the last what am I trying to say? Bankruptcy that the city went through. There was about 150, 170 police officers that unfortunately had to be fired, laid off, what have you. So what we are driving to see is that this narrative is changed relative to this work, and that the narrative becomes this partnership between our police department, our city officials, government officials, and those that do our direct service, community violence intervention and prevention work, along with organizations like ICUC, which again, as I stated before, organize in our faith-based spaces, because there's also the support of our churches and synagogues, mosques throughout the city that have come together to make sure that San Bernardino is a safer place to live, to work, to congregate in our faith-based spaces. I think I've covered what I've wanted to cover, and I'm open for any questions that you may have at the appropriate time. Thank you again.
Thank you so much, Kelvin, for sharing and for all your really important work in this space. Like Kelvin said, we do have time for questions. If folks have questions about how Kelvin and the organization have been moving through this work, any challenges they might be seeing, continued reasons that they get up in the morning, continue to work hard on these issues. And we'll also have space for questions toward the end, if folks need to percolate a little bit more on how this fits into their day-to-day.
I just actually wanted to flag one quick note that comes up, and I've heard Kelvin speak before. It's always inspiring. And I just wanted to name that one of the things we're going to talk about a little bit later when we get into thinking about messages is that, you know, I think the experience in San Bernardino and elsewhere really speaks to the fact that when we're talking about injury and death from firearms and what to do about it, we're coming up against with so many misconceptions and preconceived notions about what works and what doesn't, that a lot of the messaging work we do really has to kind of meet that head on and acknowledge and be prepared to name the assumptions people have, and then how our work and the things that we're trying to advance goes against that. So I just really wanted to name how well the stories from San Bernardino really illustrate kind of the impetus for this work, and then also some of the specific messaging considerations that come up when we're talking about, like, how do we tell people that there are ways to make our community safer that don't depend on just policing, because that's maybe the frame and the assumption that a lot of folks are going to be coming into the conversation with. So anyway, I love it when I see all the pieces coming together, and I couldn't stop myself from saying something. So I see Kelvin smiling. He's like, I know she's going to talk.
Hi, I have a question. Hi, Kelvin. I'm Mary Lou from the California Wellness Foundation, and thank you for sharing your experiences and stories. And I'm curious if maybe there's a specific intervention or example you can share with us of how you've either worked with police or with journalists to kind of turn things in a different direction, right? That could lead to a different kind of outcome and story that comes out of an incident instead of, you know, the kind of typical thing that we see too often.
Yeah, so one thing is or I should say myself in particularly, I have a lot of one-to-ones with law enforcement officers, and subsequently we schedule research meetings, and particularly with our chief of police. We had the last one in January at the San Bernardino Police Department. I think we had about 20 faith leaders around the table to meet with the chief of police to discuss our work, and mainly allowing the faith leaders to speak at that meeting about their concerns, but more so to show their support of the work that has been done. And as a result of that meeting, actually, when that meeting had concluded, one of our direct service partners, the executive director of Hope Culture, actually received, I think it was about a $2,500 check in support of the work from the police department. I say that, and I should have said this first, actually, because the newly appointed chief of police had really no idea of the capacity of work that had been done by our direct service workers. Another aspect is that when we hear about narratives that are being built in different meetings, whether those are city council meetings or other commission-led meetings in the city, then we will show up with our leaders and counter that narrative, not so much in a disruptive way. Well, I guess it is disruptive in a way, but I should say not verbally disruptive in a disrespectful way, but just again, countering that narrative, giving statistics that really we receive from one of our San Bernardino Police Department partners in a shoot review that is done every week with our executive directors of our partner-led work. So those are a few things that we have done. We have hired within our organization internally a year ago a gentleman by the name of Frank Forgot Frank's last name, it escapes me right now. But he leads all of our media-led work. And so right now, what we are doing is we are really intentional about flooding our social media pages with information about our work. And we are doing as much as we can to connect with local media to do the same. And I just had a meeting with him about a month ago about establishing a podcast where we can bring in our local faith leaders as well as get testimonies from, excuse me, testimonies from some of the clients that have been helped by the direct service work.
Thank you so much, Kelvin.
Thanks, Kelvin and Mary Lou, for that question. Any other questions for Kelvin? Okay. We know folks have been sitting for a while. The next part of our training is really the hands-on, the practical aspect of what we came here to do today. So we just want to give people a moment to just get up and stretch your legs for 5 minutes before we come back. And like I said, at the top of the hour, really put pen to paper, start working on the messages, understand a little bit more about BMSG's theoretical framework and what we recommend in terms of media strategy. So why don't we take 5 minutes, come back at about 2:56. Nope, that's my time because I'm in Missouri, 12:56. And we will get into more of the active part of our work together today. So just take about 5 minutes. Thank you. Okay. So in the second part of our time together, we are going to jump into, like I said, some of the practical aspects of BMSG's work. I want to introduce some of the theoretical frameworks that we use, both in analyzing how effective messages are in the news and understanding what makes an effective message, as well as guiding advocates in communities. So let me get to the right slide here since we've moved around just a tiny bit. I think where we want to start is right here. Great. So if you've worked at all with BMSG, you've undoubtedly heard us talk about our layers of strategy. And the idea behind the layers of strategy is that what we say is you can't have a communication strategy without an overall strategy. And so we built the layers of strategy to help conceptualize this idea that fundamentally you have to understand what you're trying to do before you know what you want to say about that thing. So the layers of strategy helps us visualize this idea that overall strategy and ultimately understanding what's the problem that you're trying to solve always comes first. So you'll see this, these layers, these 5 ellipses on the screen. Overall strategy always comes first. Then from there, we start to talk about media strategy. If you want to use the media, if you can reach your decision makers in other ways, there might be a better way to reach the decision maker, message strategy and access strategy. And we'll talk a little bit more about some of those later on, but really for now, what I want to do is get into overall strategy. So in overall strategy, what we do is a few different things. We define the problem that we want to address. So really naming the issue as specifically as possible, what we want to see addressed in our community. Then what's the solution for which we'll advocate? We know, especially when we're talking about violence prevention and healing, there are numerous solutions for any given problem. So when we're talking about advancing change and reaching decision makers, we want to be able to pair a problem and a solution together so we can only name one solution at a time. So we're defining the problem that we want to address. We're going to clarify the solution for which we're advocating. And we're going to walk you through an example of this in just a minute if it's feeling too abstract. We want to understand who is the person or the body, the group of people who have the power to make the change that you seek. So we know that we're really focused on, excuse me, one moment. Okay, really focused on that systems change work. And so who is in a position of power to create the systems and structures that we want to see in our community that are going to reduce the violence as we see it today? Who are the allies that we can help work together to make our case? We don't ever want to be working in silos on this. And then what are the actions that we're going to take? None of this happens without some hard work. So what are those to-dos that we're going to have on our lists to help us get through all of the things that we need to get through to reach decision makers and affect this change? I see some chat going on or some conversation going on in the chat. It sounds
Mary
like
Lou and I are having a research nerd conversation, so I don't want to distract you, Ingrid. I can speak a little bit more about our methods there. So
great. Is this a good time to talk about the research nerd methods, or do you want to hold off from that for a second? Totally up to you.
Let's hold off on that. I'll put some more in the chat to expand on it. But I think
Okay,
this is a
perfect.
perfect place.
Much better for Pamela to talk about the research than I. Okay, so in terms of our overall strategy, what does it look like in practice? So here's an example of what overall strategy might look like in practice. So if we're naming a specific problem, the one problem, this is a problem that we know is true. We're using it just as an example for today. So the providers helping domestic violence survivors stay safe may not have all the information they need to help survivors create effective safety plans, meaning they may not have all the information that they need from the survivors themselves about the experience of the survivor. And one solution would be that domestic service providers should be trained to ask survivors whether the person who harmed them has access to firearms and about the safety tools that are available. So making sure that they have all the information from survivors and they're able to broach those really difficult conversations to glean that information to develop a really effective safety plan. Who's in a position of power around this? It would be the leadership at local domestic service provider organizations, right? So who are the folks that are developing and delivering these trainings for the domestic service providers, and encouraging them to ask these hard questions that we don't necessarily we know that they're really difficult to have these conversations, and we want to make sure that we're getting the right information from survivors to understand how we can be most helpful for them. Again, who are the allies and possible messengers on this? Maybe it's other service provider networks, survivors themselves, folks who have been working on this, maybe it's the clinicians, and then actions. What do we want to do when we actually get to work on Monday? What's our assignment? So meeting with domestic violence organizational leaders, collecting resources to help providers learn how to broach difficult topics. So this is just a brainstorm. It's just like a snapshot of what this overall strategy might look like if we're looking at one specific problem. And this particular problem being making sure that domestic violence survivor providers have the information that they need to help survivors stay as safe as possible. So what we'd like to ask from you at this time is, what's a problem that you're working on that you could name and use as a practice for today's exercise? And be specific as possible. So we know that there's so many big thorny issues out there in the world of public health and social justice. What's one small thing that you are trying to see change in your community, in your work, that you could name as an example to help work through this overall strategy exercise? So we're going to give you 5 minutes, and then we're going to come back to the group and just have a conversation about this so that we can understand how we can get our problems and our solutions paired up together. Okay, thank you so much, everyone, for participating in that. I see some great messages here in the chat. I'll just start from the first ones that came in, and then we can debrief a little bit. So Beth says, problem statement. The general public and policymakers don't believe that firearm-related injuries and deaths are preventable and that there are proven public health solutions. Thank you so much, Beth. Can you say a little bit more about what that means?
Sure. We've done some very beginning message testing with focus groups at CDC, and they just don't buy our prevention messages. And the focus groups have been pretty adamant that they don't believe that those types of injuries and deaths are preventable. And so we think we have a lot of work to do in that space to garner future investments and to get participation in the proven public health strategies that communities can engage in. So we're trying to figure out how to change the narrative in about that.
Great. Thanks for elaborating on that. So one of the things that we'll get into in just a few minutes when we start to talk about sort of the elements of a message and how to put your message and your problem and your solution statement together is being really specific. So when you say the general public and policymakers don't believe that firearm-related injuries are preventable, you mentioned CDC. Is there a specific body that you could name? Even though there are large swaths of communities, maybe large, number of organizations across the country that are having a hard time believing this, if you had to start with one, where would you start?
I would start with the general public, honestly.
Okay. Okay. So I'm going to pause there. We'll get back to this when we start to get into some of the solution kind of organizing and thinking about, okay, well, so if our target audience is the general public in terms of changing their mind, what are some of the solutions that we might come up with? So thanks so much, Beth, for sharing that. I'm going to go to Diana. Diana says, there's not enough information in the media that highlights the importance of trauma care when working to decrease gun injuries and deaths. In terms of trauma care work, the National Compadres Network does a phenomenal job bringing in ancestral practices to heal people of all ages and how to navigate their emotions so that they don't turn their anger into violence. These solutions will help viewers understand that violence is preventable rather than inevitable. This is phenomenal, Diana, and you get extra credit because you're going right into your solution, which is media advocacy advanced. Can you share a little bit more about the problem with us?
Yeah, well, I think as all of us are mentioning, there's a lot of emphasis in the media in terms of narratives from law enforcement. We believe that, or I feel like viewers may believe that they are the only individuals that can intervene in cases of violence, when in reality there are other practices like NCN that bring healing, trauma care, and just a community-centered approach to combating violence. And I think that's very important when we're trying to advocate for other solutions rather than bring law enforcement into these conversations.
Great. And so I have a similar question for you as I had for Beth. If you had to think about one entity or one person in a position of power that needed more information on trauma-informed care, who would that be? Where would you start?
I think funders who are investing in programs, but also politicians.
Okay.
Yeah.
Great. Yeah, so just keep that in mind as we go into some of the solutions oriented work in just a few minutes. Problem from Mary Lou. Local governments continue to expand funding for police and are reluctant to support community-based alternatives to law enforcement. Mary Lou, thanks so much for sharing this. My question for you is a little different than the other folks. I'm wondering, can you share why this is a problem? Why is it a problem that local governments are expanding funding for police?
Well, I think there are many problems associated with the problem. One is that when there are more police, there's more criminalization of activity in communities, because
Mhm.
that's what police generally know how to do. And I also think that when there are more police, given the finite number of dollars in local budgets, it takes away possible resources from the pie that could be granted to alternatives that are not centered on law enforcement. So, you know, in most local budgets, as I'm sure many folks know, upwards of 50% of the budget of cities goes to police departments and law enforcement and public safety. So that's a huge amount of our money locally that, you know, we have a choice about every year in the budget process. And so calling attention to that, I think could also potentially create space then for funding alternatives. And I think when cities fund alternatives or governments do, they have more credibility, right? So that when journalists or others are, you know, when these alternative strategies and options are highlighted for journalists, having funding from local governments helps add to the credibility of that work and makes it feel like a more normal part of what we do in local government to advance and center community solutions for violence prevention. Also, I think they spend way too much money on their PR departments, and there's like a whole press release machine, as I mentioned, that starts the whole chain reaction of this kind of boilerplate coverage of crime and violence that is just so harmful.
Mhm.
I could say more, but I'll stop.
Thanks, Mary Lou. And that makes a lot of sense. One of the things that I heard you saying and sort of doing as you were walking us through that, is that one of the problems with expanded funding for police in communities is that by expanding funding for police, we're not putting those dollars toward other kinds of services and programs. And so in terms of naming the problem, as we go through the exercise later on, it may be that you shift the language to really focus on, we don't have enough funding for X, Y, or Z programs that have been shown to be effective, in part because local governments are funding police, you know, at too high of a rate. So really getting to that point of like the programs that we know are effective are not being funded at the levels that we need them to be. Again, I know this is very familiar work to you, but just wanted to use this as an opportunity to sort of show how we, in this particular case, splitting hairs is really important from a message development perspective. So just wanted to show an example of what that might look like. Let's see, one more from Melissa. We have three more, a few more. Great. I think we have time for a couple more. So Melissa says, clinicians such as physicians, nurse practitioners, PAs are in a position to reduce gun injuries and deaths by identifying risk factors and discussing safety planning with patients. But many are uncomfortable or unsure about how to start the conversation with patients that will enable them to obtain necessary information required to provide needed support and intervention such as gun locks. This is really great. I really like how this problem is so specific. That you're naming like the context in which this is happening and saying, we know that our providers are able to do this and we know that they know it's important, but maybe they don't know how to start the conversation. And so this is really helpful in terms of when you are ready to sort of name the solution that you're seeking, you have a very specific problem that you've named that's going to help you pair your solution very effectively with this problem statement. Anything else that you wanted to say about this, Melissa?
I don't think so. And I know we have limited time, but looking forward to continuing the exercise. Thank you.
Okay, perfect. And then Alexis says prevention methods to reduce young children having access to gun, which causes tragic deaths and injury. Alexis, thanks so much for sharing all this. Can you say a little bit more when you're talking about prevention methods? Can you be any more specific about which method you're thinking about?
Yeah, I know with the coalition I work for, we have a campaign around like gun lock boxes, which is just one, not the only method, but just one method to kind of help with preventing those tragic deaths among young children. So encouraging parents to like put their guns or lock their guns away when they're not in use, because that's something that we see throughout our community at higher rates.
Great. Okay, so maybe one prevention method that you're thinking about in particular are gun locks. So when you're thinking about your naming your problem, maybe you can get more quickly to the need for gun locks, either providing gun locks or educating parents about gun locks, that kind of thing.
Yes.
Great.
I was just about to say something similar. I should leave it to Ingrid, but I also wanted to flag that there's been some back and forth and things going on in the chat. And Beth, I had some ideas. I'm so sorry that I gave you a wall of text in there, but I did want to share. I had some insights that came up or some thoughts I had, and I'd love to discuss more because I've definitely been in the very position you're naming of like the impossibility of prevention, or not the impossibility of it, but coming up against that particular barrier. And so just wanted to lift that up so you don't have to read through my paragraphs in the text.
Okay. I can't wait to.
Great. Anyone have other questions or thoughts that they wanted to add to this conversation, either that you saw from your colleagues? Oh, I see Kelvin is adding a problem in here too. The fact that over 50% of city's budget is allocated to police departments creates a narrative itself, being that our city is not safe and therefore we must spend this exorbitant amount on of money to keep our cities safe from criminals and criminal activity that is Black and brown men. Great. So just the optics, I think, is what you're saying, Kelvin, that this amount of money is being allocated for police departments, gives a sense that this is, the only solution and the most effective solution, when we know that's not the case. Oh, well, there's a lot of thumbs up. That's awesome. Perfect. Okay. Well, so we want to move from this activity to the next part of overall strategy and layers of strategy, which we did put worksheets for that in the chat. So if you scroll up, and I can also just copy it one more time and just put it closer to the bottom in case folks didn't see it. All the information that we're talking about right here is actually available in some online resources. For those of you who might want to download these or are not familiar with them already. But I'm going to pause here before we get into our problem solution pairing, and invite Pam back on the screen to talk about our the new resource that is going to be launching, like she said, in early October. That's going to really be helping us in some of this framing and messaging work.
100%. So I'm really excited to get to talk a little bit with you all about the resource guide. And Ingrid, I think we just decided am I going to share screen and just show people what it looks like a little bit on the inside, or should I not?
No, you should. I just wanted a little
Excellent.
preview. Yep.
Fabulous. Well, and as you see, I get very excited about all these sorts of things. So just imagine what happens when I'm allowed to have a whole resource guide to build out with kind of building out some of the ideas that we've learned over the course of our research. So just to share in very brief, this is what's going live next week. It's called Together is Where We Save Lives, a messaging guide for California advocates working to reduce injuries and deaths from firearms. And some of the things that you'll see in this resource guide are things that we've talked about today already. So things like shaping strategy. And this is a guide that is going to have a step-by-step breakdown of how to, for instance, develop our strategy and identify our problem, and asking some of those questions that Ingrid is so good at kind of reminding us to come back to. Well, who exactly might be the person that needs to make a change, or that needs to hear what we have to say right away? Or why exactly why is that the problem? What is the issue we're trying to rectify? And there's a lot of resources here as well about things like other elements of overall strategy, like identifying your audience or thinking about allies that you can mobilize once you've decided who those kind of main people or groups of people you want to communicate with are. There's some message development pieces, which we'll talk about as well in a moment. As well, so that'll give a kind of a piece by piece breakdown of how to develop in your own work and practice in your own sphere of influence, building and developing messages that can do some of the things that we've talked about and are going to talk about further, like identifying a problem and pairing it with a solution, or talking about the values that, as Ingrid said, help us get out of bed in the morning or ground our work. So again, all of these, the resource guide is also going to include specific data points from all of our research, including all the research that I named, as well as ways to practice building that out for your own example and build your own overall strategy, your message strategy, and all the different pieces of your communications work that we've talked about here today. I also want to lift up that there's some other pieces here that I think could be helpful for folks as they're thinking about their media, as they're thinking about their work. Kelvin mentioned things like building relationships with local media. Well, this is a pretty comprehensive resource. We also give some ideas about how folks can do that in their own communities, how to pitch things to reporters, how to build relationships with reporters, etc. So some of the very things that Kelvin showed us kind of in practice today, this guide includes step-by-step instructions for how to do, and some like kind of hands-on practice to help folks, even if they're not in a conversation with Ingrid and in a space where Ingrid can help them workshop things, to help them map those things out for themselves and do some planning and strategizing. I jumped right over this. I'm sorry, I meant to go in order, but I also mentioned that all the research will be here. And for my research nerds like Mary Lou, or anybody who just wants to know more, everything that we talked about today is summarized in a lot more depth here, including a lot of what we learned about how Californians from different parts of the state think about firearms and community-led solutions, as well as some of these news patterns, some of the patterns that we see in coverage of things like that, as we talked about community level violence, or about how especially young Black and brown men are depicted in news about community violence or domestic violence involving firearms. So again, all of that data is here presented in what I hope is a fairly easy way to read. There's a lot of it, but we've done our best to break it out into digestible bits that are easy to internalize, to share with folks, or to incorporate into your own strategy. So this is, again, as I say, going live next week. We are finalizing all the last little bits of data. I don't want to scroll down too far. I keep thinking I'm going to, hit a link I'm not supposed to show people quite yet or something like that. So I'm trying to be very judicious in my scrolling. But I did want to give people an overview of this very comprehensive resource that walks us all the way through identifying our problem and our solution, our audience, our allies, the actions we want to take, how we're going to develop and generate media attention and relationships to do that, and also what messages we're going to build so that we or the people that are doing our advocacy, our messaging, whether with the media or with other audiences, can deliver messages that help overcome some of those doubts that we know people feel, that can help push up against some of those harmful frames, that can help illustrate for people the possibility of prevention when they may not be as open to thinking that that's true, that that's a possibility in the first place, as Beth named. We also, I can't show these because the code is still being developed, but we also have sample messages that show how to put all these pieces together concretely using examples culled from what's really happening around California with language that people are also free to take and adapt for their own work. So as you can see, I'm really excited about this resource. As people who are in this workshop, you are going to be getting the first link to it when it goes live. And we very much hope that this is an important and helpful resource that you can share with your, oh, excuse me, I just said okay to somebody and I don't know who it was in the little Zoom link, but I think this is going to be a very valuable resource for folks, and I'm really, really excited to share it with you all and have this be the beginning of the conversation about how we use it to change narratives in California, and more importantly, support the folks on the ground every day who are changing narratives, changing the stories we tell ourselves about safety in California through their work and through their lives.
Thank you so much for that, Pam. And Pam's going to be back in a few minutes to tell us a little bit more about the resource guide. But before we do that, we want to continue on our journey on message development. And so I want to help folks understand. I want to help folks understand where the slides are. I want to help folks understand this idea of, again, going back to the layers of strategy. We're going to jump down now to message strategy and really understanding, as we've been talking about, how to pair that problem with a specific solution and a designated audience who you think has potential to help you make the change that you're seeking. So just a little background on message strategy. This is the layer where you're thinking about your framing. What is the issue about? What do we want to say when we think about this issue? What are the words on the page that we are really thinking about communicating to our designated audience? Who's our messenger? Who is the person who might be the most effective at delivering our message? And then target, again, we're working on revising our language so that we're not repeating some negative frames, but our designated audience, who do we want to hear this? Who's that person or that body who's in a position of power to create the change that we're seeking? So when we think about a message, the components of a message that we really want to encourage people to use include values, the problem, and the solution. And if you've been on a BMSG training before, you may have heard us say something like, you know, as long as your message has each of these components, the values, the problem, and the solution incorporated throughout, you're going to be, most likely you're going to be effective. One of the things that we've learned about this particular space, in the space of violence prevention, especially with firearms, is that values need to be upfront and center. They need to be first and foremost. So why does this matter? What happens if nothing is done? Why does the continual, misallocation of funding have such an impact on the solutions that we want to see? Why does that matter? So we need that to be right at the top of our messages. And then we can get into the problem that we're trying to solve and the solution that we think would be most effective in naming that problem or in addressing that problem. So one of the ways that we do this is we talk about the message, the problem and the solution sort of being paired together. One of the things that we say often is you want to name the problem in terms of the solution that you want to see. So if you want to see funding reallocated so that less funding is going to police departments and more funding at the county level is going to community-based organizations, then the problem that you need to name is that the funding is misaligned for the needs that we have in our community, right? So if you have your solution in mind already, it helps you identify a really specific problem so that people can understand why your solution is so important. And again, we're going to have an opportunity to practice this, workshop this a little bit all together. But I wanted to just show this visual as a way for people to understand why this is so important and how this works in practice. One of the things that we know from the research, and I'll share a few bullet points here, a few top lines here, and then invite Pam to add on anything. But one thing we know to be true is that we want to show the landscape. What are the conditions? What are the circumstances? What is the lived experience of people who are going through these day-to-day experiences of violence? And how can we envision systemic solutions? How can we envision solutions that are really showing what people are experiencing in that day-to-day and understand that there are systems and structures behind those experiences? So really broadening that frame, reducing that focus that we see so often on individual behavior change, and really focused on what are the systems in place that have led us to these problems. Narratives need to include a call to action and show success. We need to know what's been effective in the community, and how can we build on that? How can we model those successes in other communities so that audience can see that change is possible and inspire them to be a part of it? And then also acknowledging that people have really complicated feelings and doubts about firearms. We know this is a very, very complicated issue in our society. And people tend to come to these conversations with a lot of very strongly and deeply held beliefs. And so how can we acknowledge that while at the same time still putting forth the solutions that we want to see? Pam, anything else that you wanted to add related to the research that you're seeing and the messages that you've helped develop?
Yeah, just a couple quick notes here. One, showing the landscape. Part of that is also to help connect some of the things that we heard about where people don't really know that firearm suicide or domestic violence involving firearms are major drivers of violence and injury. So sometimes connecting to the landscape might just be helping people understand that when we talk about safe communities, maybe what we also need to be talking about is keeping families safe from family violence when a firearm is present, for example, just helping people thread that needle a little bit more because it's not what people's minds tend to go to when they think about firearms. The calling to action and illustrate success, I think some of that gets to the issue that Beth and I were going back and forth a little bit about in the chat, was around the fact that people don't really understand what prevention or healing or intervention means. And so having some really concrete examples of like what it is that we're proposing and why that works is more important here than in almost any other issue I've worked on. Because again, it's the place where people have the biggest black hole in their minds of like, well, what do you mean prevention? What do you mean interrupting violence? That's not something. And so if you can point to success or even envision success, this is what it could look like if we succeed. That helps people get one step closer to filling in that black hole and sort of say, oh, okay, all right. No, wait a minute, that's interesting. Finally, I wanted to say the acknowledging that people have complex feelings and doubts, not only about firearms, but about some of the times the solutions we're talking about. So sometimes acknowledging is just saying something like Kelvin does so beautifully, saying, sometimes we don't think about our community members or community-led organizations when we're thinking about how to keep the community safe. We're just thinking about the police. But I'm here to tell you that there are other people in this community who are working to build the place that we live and the place that we want to live. And they're part of the conversation too. So sometimes that acknowledgement is actually just really helping acknowledge that this may not be something you've ever thought of or heard about before. You may not be used to thinking about non-police solutions as an approach. And that's okay. We're here to talk about something different. Even just that little bit of acknowledgement can help people move one step closer, first to feeling heard, and second of all, to staying open to hearing what you have to say next. So I hope that that gives a little bit of context. So again, the basics of the values, problem, solution are key, but if we can help people move towards the kinds of injury and the kinds of solutions that we're talking about, show success and make them see that it's possible and they can be part of it, and also acknowledge that not only might they have complex feelings about guns, hey, maybe the complexity you want to acknowledge is that they're not used to thinking about solutions to guns that go beyond police. All of those things, again, help keep people open to hearing what you have to say next, and really help, especially since they are, as I said, so hungry for solutions, keeps them open to what those solutions could look like and how they could be part of what happens next.
Thanks so much, Pam. I wonder if we can tap you for a little bit longer and ask you to share a little bit more about the message guide that may relate to some of these messages that you were just talking about.
Sure. So if you can let me share my screen for a quick second. I can't show the whole thing because I believe we are still fixing a little bit of the code, but in the resource guide, I've just named a bunch of things, or a couple things, that can really help make those messages come to life and help overcome some of the barriers that we know people feel and experience when they're talking about firearms. Oops. And in the developing messages section, we go through each of these and show what it can. Oh, excuse me. I think this may be where the code problem is coming in. So, oh, no. Ha, yay, it's working. So as I said, you're getting the sneak preview. This is the blooper reel. So here, through here, we go through conversation, little examples, and with specialized language for each, drawn from the work of advocates who helped inform this guide, to show what it looks like, to how you can build a problem and a solution that are paired, how you can show the landscape. And we even include examples of data that can help make people see and understand a little bit more about, for example, the true prevalence of some of the issues we're talking about, as well as the true possibility of some of the solutions that we're seeking. We see places to think about how to brainstorm examples of success, or even envision success if the data isn't directly available to you, but you know how you want to help people start to envision it. We have examples of how to talk about complex feelings, doubts about the possibility of success, especially if people tend to be focused on federal policy or focused on policing. So we include not only places to brainstorm that, but also examples of language that people can take and use in their own practice to build in some of that language that, for example, Kelvin and other folks on this call are very practiced at doing day to day in their own work of helping meet people where they are when it comes to some of that confusion or some of those questions about what's possible and how we do it together. I don't know if that gets to everything. We will also, the part that I can't show because I know the code is still being built, is we also have the sample messages that I mentioned. Let's see if any of these are visible. Ooh, maybe Heather's gonna be mad at me, but we'll see if we can do it. Yes, okay. We also have sample messages that show how all of these building blocks come together. We have in the slides for today's session some abbreviated examples of those that can be used, but the final resource is going to be much more complete and have an actual template that people can plug the different parts of their strategy into to build a, you know, a template for a message that they can then refine and perhaps deliver and deliver in their contexts.
Great. Thank you so much, Pam. And we do want to share at least one of those messages with you as an example, but we want to lean on you for one more activity. We have about 20 minutes left together. And so with the issue that you're working on in mind, we want to ask you to write a simple message that includes this concept of value. So why does it matter that we solve this problem? What is the problem specifically that you're trying to solve? And what's the solution? I'll put those directions in the chat. It's going to be another 5-minute exercise. You can share your response either via chat or you can come off mute once we come back to the group. But again, can you put together a simple message? Again, it doesn't have to be polished. Why does it matter that we work on this issue? What is the specific problem that you're trying to solve? And what's the solution? And I think because we have a little bit of a smaller group today, folks are having to leave for other meetings, which is totally understandable. Maybe we'll just take about 3 minutes to do this. Just put some ideas down and then we'll reconvene with everyone together. And I'm going to put up on the screen one of the messages that Pam was talking about. Let's see. And what you can see about this message is, again, it's paired to be part of the domestic violence prevention work that we named in our overall strategy at the top of the hour. And it also has highlighted section. It's a little hard to read. We get it with all of this color. But the idea here is that you can see where the different components of a message are showing up in this particular message. So you see the values right on the top. You see the problem statement showing a landscape, the solution. You're acknowledging the complexity like Pam was just talking about and showing the success. And then at the very end is your call to action. What do you want to see happen as a result of this problem? So I'll just put about 3 minutes on the timer just to give folks an opportunity to work on this in their at their desks, and then we will come back together to debrief. All right, so it is time for us to come back together. If folks are putting their final touches on their messages, again, these are just short and sweet messages just to give us an opportunity to talk through some things. Oh, great, I see some coming in the chat already. So Beth says, losing a loved one to suicide is tragic. The majority of fatal suicides involve a gun. Securely storing your firearm could save the life of a loved one. Beth, I love how simple and direct this is. One of the things that we advise people all the time is to be as simple with our language as possible. So, you know, talking to your younger nephew, talking to your grandmother, talking to someone who doesn't know anything about the issue that you're working on. So I just really love the plain language of this, and how it's so clear that this is why this matters so much, and that there are solutions, and that the solutions are not too super complicated. So thank you so much for sharing this. Anything that you wanted to ask about this as you were putting it together that was challenging for you?
No, I was just trying to keep it small, right? And like narrow it down. And so I was like, it's such a big topic. I'm like, I'm just gonna take secure storage because that's a really clear message. So.
Yep, perfect. Thank you for that. Kelvin says community violence intervention workers in the city of San Bernardino are doing amazing work reducing gun homicides and gun violence. Great. So we're really showing the strengths of our community. It's an incredible value. The narrative that has been created is that these reductions are credited mainly to police departments, which may, in some cases, lessen the credibility of our CVI experts. Credibility our CVI experts have, and lessen political support, as well as financial support to sustain and further the work. And then the solution is to solicit the support of organizations such as BMSG. Oh yeah, I love the solution that involves us. Solicit the support of organizations such as BMSG to help create, shape, and in some cases counter the narrative that is being driven by those in opposition of this, the violence reduction strategy. Perfect. I mean, I honestly, it's totally unbiased. I cannot imagine a better solution to this problem. So I'm really glad that you put it forward. No, but I do think that, all kidding aside, that the solution is really powerful, that working together with organizations that are actively trying to change the narrative is really powerful, and putting that forward, helping people really see that solution, that we don't have to just sit by and wait for that narrative to change on its own, that people are being really proactive about changing the narrative and seeing where communities are as strong as possible. I think that's incredibly effective. So thank you for that. Any other problem solution pairings that folks wanted to share verbally that they didn't put in the chat? Oh, one's coming through. Pamela's also very enthusiastic about Kelvin's solution. Perfect. I think Kelvin's our plant. We're gonna have him be on all of our trainings from now on.
Love it.
Cassandra says, still brainstorming language and connections and appreciate any feedback. Perfect. Why it matters. We want to live in a community that is centered around self and communal care. Absolutely. Who couldn't get behind that? The problem is the local school district does not have a restorative justice framework in place to invest in community programs and healing initiatives, which can be a part of a long-term solution to prevent community violence. The solution, the school district should collaborate with community members to collectively design a restorative justice framework that focuses on relationship building and healing to create more opportunities for people to share space and build community accountability or communal accountability. Great. Cassandra, this is really, really powerful. I don't know if you want to come off mute if there's anything else that you wanted to say about this. Oops.
Yeah, thank
Oh, yeah, I
you.
lost
Oh, sorry.
No, go
I
ahead.
just appreciate any and all feedback y'all have. This is something that I've just started working recently and thinking of potentially creating a policy to bring forth to the local school district to really push on them creating some sort of restorative justice framework that's currently missing. And sometimes I find it a little hard to make these connections for folks to see it in the long run, right? In the long-term effects that this can have, especially in relation to preventing community violence. So yeah, again, appreciate and welcome any thoughts.
I want to
Perfect.
say I loved all these messages, but I wanted to flag here that this is a great, Cassandra, you did a great job of also tying in the visioning success, right? Though this can actually be a long-term part of a long-term solution to prevent community violence, right? So even just a phrase like that that helps people put this kind of concept they may not be super familiar with of a restorative justice framework in the vision of like, what does it do? Is really, really powerful. So I just wanted to illustrate you did that without, you know, just you seamlessly did it. I wanted to name that. The only maybe one of the other questions I might have in terms of solutions always is just kind of thinking about the and this would of course depend on where you're going to be delivering this message, but thinking about kind of what the call to action is, right? Because there's the solution of the school district, but then thinking about you know, as we know, when it comes to talking about firearms, when it comes to talking about our kids, really, to be honest, we all want to know, what do we do next, right? Like kind of what's the next ask. So as this kind of comes into into whatever shape it takes, I would think that maybe maybe one additional line at the end of the solution about like, we can get started right now. We don't have to wait. One thing we can do, you know, if there is sort of an immediate next step that could help your audience feel like there's a way that they can help get closer to that goal, I think that that would be really helpful. And I say this also not just as a researcher, but also, you know, as the mom of a kid who's in a school district, and who get, you know, when as a parent, when you read these kinds of messages or when you hear them, I think we're all thinking immediately like, what do I do next? Okay, yeah, that sounds amazing. I want to be part of it. And even if the intended audience is the school board, the parents who are also reading it in that message from the school are probably going to feel more activated if they can see some action for themselves. That might just be one thought I would have. I don't know if that's anything that Ingrid you want to add or any
No,
Sandra.
yeah, thank you so much for adding to that, Pam. Other comments or questions, either for Cassandra's or any of the other messages that we've heard? We just have a few tips that we wanted to offer folks. And then we will have a few minutes for any questions that haven't come up. Obviously, we're winding down. Okay, so you all are doing a great job. This is a weird, sorry, hang on, folks. I'm now seeing how you all are seeing the screen. Are you all seeing this full cartoon? Yes, okay, great. So we have a few tips for folks as we wrap up our work on message development. You've done a great job on this being concise. So one of the things that we say is you can't be comprehensive and strategic at the same time. People are going to lose interest. They're going to get bored. Their attention span is limited. And even more importantly, there may be some main points that you're providing that get buried in what all of the rest of the things that you're saying. So if you really want someone to focus on what you want them to know, we want to make sure that that information is up front and center and it doesn't get lost in a lot of other background that the people you're talking to may or may not need. Speaking plainly, one of our messages, I think it was Beth's early on in this section, really focused on really simple language. I think a lot of times we get into our expert mode and we want to use all of our fancy vocabulary and things like that. And a lot of times the people that we're speaking with are not as well informed about the issues that we're talking about as we are. So we really need to bring it to a level that everyone can understand. A lot of times we say, you know, bring it to the level of a sixth grader, someone really sharp person, but you don't have to be as sophisticated in your language and being really precise. You have this cute little cartoon here of all of these chairs. And one of the things that we say is if you have the opportunity to talk about what you're talking about and you want to talk about a chair, you're looking to put a special chair in your house. Be really descriptive of that chair. Don't just say, oh, I'm putting some new furniture in my house. Saying, I'm putting a new purple chair in my house that I can sit and watch TV. So you want to be very simple and really precise with your language. Always preparing for difficult questions, being honest. You want to practice pivoting back to your solution so it's easy to get taken off and start to provide lots of data and statistics, which can have a place. And we want to make sure that we're always circling back to that's important, but what's more important is, and then pivoting back to your solution. The idea of being honest is sometimes you don't have all the information. And it's okay to say that and say, if we have the information, once I have that information, I will get it to you, or my colleague is really well-versed in that, I'll have them get in touch with you. Or that's information we just don't have yet. We need more research to understand that better. And then reframing that question from portrait to landscape. Yes, this one particular story is heartbreaking, but how many stories are there out there like this? And what are we going to do to prevent any more death from firearms? We don't want to see one more in our community. So how can we change those systems and structures so that we're really changing the landscape of our communities? And then just a few tips on, or a few points to summarize. So again, narratives about domestic violence and homelessness have to bring that intersection of domestic violence and homelessness to the public agenda without reinforcing those flawed narratives about who deserves support, right? We all are in this together. And like Kelvin has mentioned a number of times, there's so many problematic frames and narratives out there that we're trying to counter. Frames can influence this type of solution that are considered possible. So we really want to show that success and show that that landscape frame, that takes us from that individual behavior to really like that systems and structural approach are really most effective. The strategic messages and the components of a message that we've been working on for the last 40 minutes or so. We have a description of the problem, the solution that we want, and most importantly, the emphasis on why it matters. And then practicing. We really want you all to take an opportunity to rehearse these messages with your colleagues, reach out to us. We're more than happy to talk through some of these problem statements with you, help build that muscle memory so that when you run into someone on the street, you can answer their questions without even thinking about it. You already have some of this work kind of in your body. So that's all from us. We want to give folks an opportunity for any last questions, and then I'll also just pass it back to Brian for some closing remarks. Any questions? I am going to put some resources in the chat as a way to sign up for more information from BMSG if you're interested, as well as an evaluation. We would really love your feedback on this particular training. It helps us improve future training. So we really do value this information from you.
I'm also sharing my my email because I know I've spoken to a few folks here who are doing amazing message development work that I would love to help brainstorm and think about. So please don't hesitate to reach out. We can keep hashing some of this all out together. I mean, Kelvin, I'm going to be bothering you all day, but and as I said, anybody who signed up for this training, you will be receiving the message guide link when it goes live, as well as as I said, that's the basics are really core. We talked about them here. Things like be specific, use plain language, make sure your problem and solution match, and talk about why it matters, right? Those are some core things, but there's a lot more that we dig into. So if you're a person who, like me, likes to know all the background, that resource is going to have everything for you and really offer a lot of step-by-step pieces. And again, even if it's not the right fit for you, it might be for those in your network who are trying to look at take different pieces away of developing either a message or a communication strategy as they work to keep our communities and ourselves safe.
All right, Brian, anything you wanted to say as we close out today?
Sure. I thought I was interviewing sirens in downtown LA, but apparently not so fast, but hopefully everyone can hear me okay. Anyway, first of all, thank you to everybody who participated. I know that some people had to drop off. We had a really great training a few days ago, and this look, I kind of came back in the last 40 minutes, and it's very robust. So I really loved what I was hearing. We hope you found this very beneficial. We're open to ideas about how to get this training to more folks in our state. We think this is incredibly important. But I would like to thank Ingrid and Pam from Berkeley Media Studies Group for all their work on this, especially Pam, you and your team, all the work you've been doing over the last 7.5 years. Kelvin, thank you very much. Appreciate you for giving us your time and your wisdom and all of that. And thank you just to everybody. And one last thing, again, I'm in siren heck here. If you have ideas about how we can help you all increase your capacity to do the kind of communications, that would be fantastic. We know that the messaging is important. been training on that, but we know that a lot of community-based organizations are very strapped, right? How can we help you increase your capacity? How can we do more of these? We would love to hear from you and your ideas. But with that, just again, super appreciative of everybody for their time, and onward we go. So thank you very much.
Thanks, Brian, and thanks to everyone for participating and hanging on to the very end. We really appreciate it. And yeah, keep an eye out for more resources, including the messaging guide that Pam was talking about next month. Take care, everyone.